Hare Krishna, welcome to our channel Nurture It with Yoga. Today I'm going to tell you about the vitamin A. So let's start with the video. So vitamin A is a fat soluble vitamin that can be divided into two groups. One is retinoids or aldehydes and carotenoids. Now retinoids come from animals and can also be preformed or active vitamin A because they are already in the form that is usable by the body. Now retinol and retinoic acid, which are both found in fish, are also included in this grouping. Next comes to carotenoids. Carotenoids, on the other hand, are found in plants and are called provitamins, which means they are stored in liver and converted into usable vitamin as needed. These include beta carotene, alpha carotene, and gamma carotene. Beta carotene is most popular and thoroughly studied. After carotenoids are converted into vitamin A, they react as preformed vitamin A does in body. Alright. Now the functions of vitamin A. Now first function, it will be support the skin. Next, needed to detoxify polychlorinated biphenyl, which is PCB. Any of group of highly toxic compounds often found in industrial waste, and dioxin. Then reduce risk for cancer. It improves esophageal, bladder, stomach, and skin, as well as leukemia and lymphoma. Also, it's responsible for healthy mucous membranes. Also, it strengthens bone during development. Then it comes for immunity. Now, epithelial layers serve as crucial barrier against pathogens and vitamin A, and is a necessity to maintain their health and normal function. And vitamin A also plays a role in the production and function of your white blood cells, which help capture and clear pathogens from bloodstream. Now it improves white blood cells, natural killer cells, and macrophages, and T and B lymphocytes as well. Next function comes as growth. Loss of appetite is one of the first signs of vitamin A insufficiency, which is then followed by termination of growth, rapid weight loss, and ultimately death. Now most important part is vision. Vitamin A is crucial for vision as it enables the formation of pigments in the eyes, which is retina, and that is necessary to see the full range of light. Now comes to the next point, which is reproduction. Vitamin A is now recognized as crucial for the health for both mother and children. It is needed for growth of sperm and eggs, as well as the development of maintenance of fetal tissues placement in health. Now before moving on, I must tell you about the free radical and antioxidants. So what are free radicals? Free radicals are unstable molecules that are created when the body breaks down nutrients and it exposed to environmental toxins. They can damage cells and increase the risk of disease. So that are free radical. Now come to the antioxidant. Antioxidants help to protect the cells from damaging caused by the free radicals. So you can see here, it is doing the pair part. It is unpaired electron, that is free electron, that will damage your cell. So antioxidant is actually pairing with the electron so that the damage can be minimized and it will save your cell health. Few antioxidants you can say as vitamin C, vitamin E, then selenium, carotenoids, flavonoids. These are antioxidants. Now come to the next part, which is antioxidant properties. Now vitamin A also acts as antioxidant in human body. Antioxidants protect cells from effects of free radicals, as I said, or reactive oxygen species, which is ROS. The body forms ROS when it converts food into energy, and antioxidant protects cells from damaging effect of ROS. Now free radical cell damage is responsible for development of cardiovascular diseases and cancer as well. Now comes to vitamin A and diabetes. Now one research has found that beta cells of pancreas, which help controlling blood glucose, become dysfunctional in people with type 2 diabetes when vitamin A is lacking. However, when vitamin A is reintroduced into the diet, beta cell function and blood glucose levels become normal once again. Retinol's ability to resurface the skin erase fine wrinkles and shield it from microorganisms that can cause acne. Vitamin A is particularly admired in dermatology as well. Now come to the absorption and transportation part. Now how it is done? Vitamin A is found in retinal ester form in non-vegetarian sources and as beta carotene in vegetarian sources. We can see here beta carotene, right? After consumption, retinal esters are converted into retinol in the intestine, while beta carotene is converted into retinol, okay, and then retinal esters. Now, in retinal esters are transported to the liver. After that, it is transported to the liver, where it is stored there. Now, when body requires vitamin A, the liver converts the stored retinal ester into retinol, which is then carried to the triggered cell to be used. Now, retinol is converted into retinoic acid in target cell, which plays a vital role in various reactions. So that is all about the absorption and transportation of vitamin A. Now come to the sources. Now sources as per concern, one is plant, another one is animal. Green leafy vegetables, green, orange and yellow vegetables, fortified breakfast cereals, margarine, orange colored fruits, amaranthus leaves, coriander leaves, colocasia leaves, spinach, carrot, pumpkin, jackfruit, ripe mango, orange, tomato, all these are plant sources. Now animal based sources, eggs, liver, fish, dairy products and cod liver oil, or else you can say butter, hydrogenated oil, ghee, egg, whole milk powder, cheese, cow's milk, buffalo milk, curd and fish. So all these are animal sources. Now few noteworthy points it has to be noted, like animal meals contain retinol and other related molecules which are naturally highly accessible forms of vitamin A. The richest animal source of retinol is beef liver. Consuming about 2 eggs yolks per day provides all required vitamins A for your body. Now in India, the B carotene or say beta carotene, which is found in numerous vegetable sources, provides more than 80% of daily need of vitamin A. If you eat a lot of whole foods, you can easily meet the RDA, which is recommended dietary allowance for vitamin A. Now few facts also to be noted. Eating carrots to improve night vision is semi-myth. The beta carotene in carrots help the eyes to adjust in dim light. However, vitamin A cannot give superpowers of night vision or cure dependence on contact lenses. Eating an adequate amount of vitamin A from any sources support your eye health. Now what is the recommended RD allowances? Now what are the daily requirement for men and women? For men it is 1000 mcg per day and for women it is 840 mcg per day. Mcg means microgram, which is 1/1,000,000th of gram. So that's how we can understand. Now let's discuss what are the symptoms of vitamin A deficiency. First thing is decrease in steroid synthesis, dry eyes, fatigue, hypothyroidism, that is low thyroid production, increase of susceptibility to infections, increased susceptibility to vaginal yeast infections, night blindness, poor tooth and bone function, poor wound healing, rough and scaly skin. These are the symptoms. Now let's talk about deficiency disorders. Certain groups of people such as people with cystic fibrosis, Crohn's disease, ulcerative colitis and celiac disease are at high risk of developing vitamin A deficiency. Then in eyes, night blindness, which is called as nyctalopia. This is a condition in which an individual is unable to see clearly in dim light. The speed with which the eye recovers its full power after exposure to bright light is directly related to the amount of vitamin A that is available from the rhodopsin. Then conjunctival xerosis. The conjunctival is the eye becomes dry and thickened, wrinkled and pigmented. Then bitter spot. There is a condition where spots develop in eyes. These spots are raised, muddy and dry, triangular patches. In corneal xerosis, when dryness spreads to the cornea, there is a dull, hazy, lusterless appearance due to keratinization. This leads to dryness and lack of vision ultimately. Then keratomalacia. In this condition, there is softening of cornea which can affect the lenses. Now in fact, an estimated 2.5 lakh to 5 lakh children who are vitamin A deficient become blind every year, and half of them die within 12 months of losing their sight, which is given by WHO, World Health Organization. Now, in case of non-ocular, that is non-eye related skin, vitamin A deficiency can have adverse effect on skin, leading to a condition called follicular hyperkeratosis. This condition is characterized by the disposition of keratin on hair follicle, resulting in a rough and uneven skin surface. That sweat glands may also lose their capacity of secretion. Then mucous membrane. Vitamin A deficiency can have adverse effect on the mucous membrane, which is the inner lining of the body that is lubricated due to secretion of mucus. In the absence of adequate vitamin A, the mucous membrane loses its ability to secrete mucus, resulting in dryness. The respiratory tract, reproductive tract, and gastrointestinal tract are commonly affected. Other complications can be like growth and development may be hindered, bone deformity may take place, the teeth may become thin, kidney stones may develop, loss of taste and smell may be seen, infertility may also be present. Now, some causes of vitamin A deficiency, like antibiotics, cholesterol lowering medicines, diabetes, laxatives, malabsorption, malnutrition, medication, or products that decrease fat absorption. Now, what are the side effects and contradictions? Excess vitamin A consumption can cause liver damage and even death. If you are taking a high dose, you need to have your doctor measure your calcium and liver enzymes on regular basis. If you have liver disease, or you are a smoker, or exposed to asbestos, or are pregnant, you should not consume high doses of vitamin A. Also, a recent study suggested that daily intake of even 5,000 international units of vitamin A from dietary sources for more than 20 years may increase hip fractures in women. So these are the few symptoms and contradictions. Now come to the part of toxicity. It's crucial to stay under the tolerable upper limit intake of 3000 mcg per day for adults to avoid toxicity for vitamin A. If you consume exceptionally high dose of vitamin A, it may deadly and have major negative effects as well. Even a single extremely high dose of vitamin A can cause vitamin A toxicity over a short period of time. When doses greater than 10 times of RDA, which is recommended dietary allowance, are consumed over an extended period, chronic toxicity can be a result. Too much carotenoid can turn the skin yellow, orange. This is harmless. Too much retinol, usually from supplements, can cause hypervitaminosis of A and leads to the few diseases such as vision disturbances, joint and bone pain, poor appetite, nausea, vomiting, sunlight sensitivity, hair loss, headache, dry skin, liver damage, jaundice, delayed growth, confusion, itchy skin also. Now let's talk about carotenoids. So there are over 700 carotenoids on earth. Only 60 of them are found in food. The typical in American diet includes that only 6 of them, which is alpha carotene, beta carotene, cryptoxanthin, lycopene, lutein, and zeaxanthin. So alpha carotene, beta carotene, and cryptoxanthin are converted into vitamin A inside your body. But beware, however, that if you have hypothyroidism, your body may unable to convert beta carotene into vitamin A. Then comes to lycopene. The carotenoid lycopene is an antioxidant that may lower the risk of some types of cancer. It best absorbed when cooked with fat. Like pizza, therefore, which may contain tomatoes and have been cooked with oil and cheese, is good for source of lycopene. Fresh tomatoes, on the other hand, are not good source. So the functions of lycopene in your body: it decreases the LDL, which is bad cholesterol in your body, helps to prevent prostate cancer, and lowers your blood pressure. What is the recommended dosage? Like 5 to 20 mg daily. Pharmacologic doses of single carotenoid may result in inhibiting other carotenoids at your cell receptor sites. Also, a study called beta carotene and retinol efficiency trial has shown that smokers who take carotenoids may have high risk of developing lung cancer. However, high doses of carotenoids are non-toxic, unlike high doses of vitamin A. And because excess carotenoids are stored in your liver until it is needed by your body. Now the sources, like dark green leafy vegetables, guavas, pink, grapefruit, tomatoes, watermelon. These are the sources of lycopene. We'll come to lutein and zeaxanthin. Now, lutein and zeaxanthin are carotenoids that are contained within the retina of your eye. They help eye absorb light when also protecting it from various free radicals. The functions of lutein and zeaxanthin in the body to help prevent cataracts and protect against molecular degradation. Dosage required, it is 6 to 12 mg daily. Now, food sources of lutein and zeaxanthin: collard greens, corn, egg yolks, green leafy vegetables, kale, spinach. Then we will come to cryptozeaxanthin. There has been less research in cryptozeaxanthin than with the carotenoids. However, there is significant evidence that it may effectively reduce your risk of cancer. Food sources: butter, egg yolk, oranges, papaya, peaches. Functions of cryptozeaxanthin in your body: it may prevent cataracts and protect against molecular degeneration. May protect against various types of cancer, particularly cervical cancer. Recommended dosage 4 mg per day. So that's all folks for today about vitamin A. If you like my video, please do subscribe to my channel, like it, share it, comment it, and don't forget to press the bell button so that whenever I post a new video over here, you'll get the notification of it immediately. Thank you so much for being with me till the end of the video. I know it's a pretty long video, but thank you so much